Hi there, I'm Dr. Aishwarya Nupur, fertility consultant at Arete Hospitals. A lot has been talked and discussed about female infertility, but what about the male? We neglect him, but the male infertility is certainly on the rise. Now what happens in male infertility? We should know how do we manage those problems. Suppose their brain is not producing enough hormones. We can supplement the hormones. This is a long treatment for 1 or 2 years, but surprisingly and happily we found spontaneous pregnancies also happening. The sperms appear in the semen. Now second, if the hormones are there but the sperms are not being produced in the testis, in that case we have to do something called testicular sperm aspiration. We give a small anesthesia and with a needle we aspirate the tissue and check under the microscope if there are sperms present. We can do a higher magnification aspiration also, which is called MicroTESE, under 20 to 30x magnification, and then there are 30% more chances to retrieve sperms. Suppose there is a block in the outlet but there is enough production in the testis. That is very simple. We can just put a small needle at the head of the testis called the epididymis and we can aspirate good number of sperms from there. There is another condition called varicocele, which is much talked about. Grade 1 varicocele, grade 2 varicocele, and a lot of surgery is happening there. What is varicocele? It is dilatation of the blood vessels in your inguinal region, which can compress the outlet and the sperms can get affected. In that case, a simple clinical examination by an andrologist can help. If the varicocele is grade 3 or 4, we can go for a surgery called varicocelectomy, which can relieve the stress and we can get better quality sperms. Now suppose we've done all the workup. The hormones are in place, the testis is producing the sperms, there is no block in the outlet, there are no varicoceles. And in the semen, the sperm count, motility and the morphology also looks okay. Still, they are not able to conceive and the female partner is totally normal. In that case, we can do a test called DFI, DNA Fragmentation Index. The sperm head contains DNA. At times, there are breaks in the DNA which lead to inability to conceive or repeated miscarriages as well. In that case, if the DFI comes high, we can advise them lifestyle modifications, weight reduction, healthy eating, physical activity, and also we can put them on some antioxidants. 3 months later, the semen analysis can be repeated and they can proceed with the treatment. Thank you.